Hi, ladies and gentlemen. Good afternoon to you and welcome to the second lunchtime webinar brought to you by iXchange 2026, where we help you level up your health. My name is James and it's great to see you again. We have an exciting lineup ahead today for you. Now, theme today, connecting health to you seamlessly. And this is where we explore workplace health uncovered from everyday pain to long-term prevention. Now, we are really lucky today. We have for you great doctors. First and foremost, we have Dr. Wei Wee Steckley. She's an obstetrician and gynecologist from Glen Eagles Hospital. And guess what? We have for you two orthopedic surgeons today who's joining us, Dr. Ivan Chua and Dr. Huang Yilun. We're very lucky to have them. And before we begin, we'd like to say a big thank you to those of you who have submitted questions earlier. We will come to your questions at the end of today's session during the Q&A. Now, three topics to be covered today. Now, first and foremost, all about women's health at work, thriving through your 30s to your 50s. And second, we will be talking about osteoporosis, the silent risk in working adults, especially for those of us who's always at our working desks, not moving any way at all. And finally, back and neck pain from desk work. Fix it now. So three amazing topics, three amazing doctors. Ladies and gentlemen, again, for those of you who have questions, please submit them through the chat box and we'll work through with them all the way to the Q&A session and we'll answer them at the end. So, ladies and gentlemen, first off, we're proud to bring you Dr. Wei Wee Steckley, obstetrician and gynecologist from Glen Eagles Hospital. Now, this doctor, amazingly, she's here with us today. She graduated from Guy's, King's and St. Thomas School of Medicine and King's College London and holds specialist qualifications and fellowships from both the UK and Singapore. She's also currently the senior consultant at Weiwei Clinic for Women at Gleneagles Hospital and was formerly a senior consultant with the Minimally Invasive Surgery Unit at KK's Women's and Children's Hospital. Now, beyond her practice, Dr. Wee is also passionate about education and training, serving as adjunct assistant professor at both NUS Yong Lu Lin School of Medicine and Duke NUS Medical School. She's amazing. Now, ladies and gentlemen, let's welcome Dr. Weiwei Stegley.
Thank you, James, for your kind introduction. Hello, everyone. My name is Dr. Weiwei Stegley, and thank you for inviting me here today. Today, I've been given a very big topic. We're going to talk to you about women's health at work, thriving through the 30s to 50s. I've only got 20 minutes, a very big topic for me to focus on. So I'm just going to narrow dive into menopause, which I'm sure a lot of us will want to know more about. So let's dive right in. So what is menopause? Menopause is 12 months consecutively of no period. So just a little bit of stats. NUH did a survey last year and found that the age of menopause averagely is 49. That has come down from 50 to 51 many years back. More than half of midlife women in Singapore experience moderate to severe menopause symptoms. So what are the signs and symptoms of menopause? We all know hot flushes, the familiar night sweats waking you up, your mood swings, anxiety, dry skin and vagina, loss of hair, thinning of hair, needing to pee frequently, especially at night, reduced sexual energy, low energy at work, joint pain and aches, brain fog, which simply means memory loss, unable to focus at night, unable to focus at work. And of course, if you have any of that, and if you're unable to cope with the symptoms, depression may ensue. So more about stats, 90% of women say their workplace offer no help for menopausal women workers. And the main symptoms that they complained will be 73% hot flushes, 63% being lethargic at work, 48% low mood, 47% unable to focus and concentrate, 43% having troubles with their memories. 34% of women develop depression and anxiety, and almost 30% say that they've lost confidence at their workplace. So important to take note. Depression during menopause is something we underdiagnose. Certain women are more susceptible to depression and anxiety during their menopausal journey. So if you experience any of these symptoms, please do not suffer in silence. Please seek help. So how do we diagnose menopause? We can do a blood test. It's called FSH, which stands for follicular stimulating hormone. Anything more than 30 diagnose you to be menopausal. However, one blood test may not be totally representative. You need at least 2 to trend. Alternatively, you can just go clinically. If you have any menopausal symptoms coupled with the fact that you have no more menses continuously for 12 months, that puts you into the menopausal category. So what are the common myths of menopause? Let's have some fun. So myth number 1, menopause only occurs in women over 50. Now this is false. Menopause typically occurs as early as 45, sometimes earlier. We kind of follow our mothers, so find out when did your mother menopause, we'll follow the same. But it can happen earlier than 45 due to many reasons, including genetics as mentioned, or if you've done repeated surgeries on your ovaries. Myth number 2, menopause means the end of a woman's sexuality. That's false. Sexual health can remain positive as part of your life with proper support and guidance. Some women even report an increase in libido after menopause. Myth number 3, weight gain is inevitable during menopause. Now this is also false. While weight fluctuations are very common, maintaining a healthy weight is possible with exercise and proper diet. The next myth, hot flushes and night sweats are unbearable and unavoidable. Now, this is also false. The frequency and severity of hot flushes and night sweats will vary from women to women. Some women do not have symptoms at all. There are various options available, and including lifestyle adjustments and medical treatments. The next myth, menopause is the same for all women. False. Menopause is a very personal journey, and symptoms can vary in severity and the type of symptoms. So some women, they don't even experience any symptoms. I always tell my patients this story. My mother in her 40s definitely would have benefited from HRT. We were all tiptoeing around her at home because she had outbursts of temper and nothing seems to be going right. Everything is wrong with her. And my mom would have benefited. My best friend Audrey's mother, same age, both born in the year of dragon, never had any symptoms. She was like an angel compared to my mother. So not everybody goes through menopause the same way. Next myth, HRT is dangerous. Well, this is false, okay? It can be safe and an effective option for managing your menopausal symptoms when prescribed by a gynecologist or a GP who's experienced in the management. So let's go to the management of menopause. So important to have a balanced, healthy diet, which includes important things like increasing your protein uptake. Taking multivitamins is important to fill up the gaps of what you're missing in your diet. Adequate sleep, such a luxury. But if you can aim for 7 to 8 hours per night, that would be ideal. Exercising regularly, and I'm talking about 2 to 3 times a week, include cardio, include strength training to build your muscle mass, which is so important nowadays. Quit smoking, and that includes vaping. Reduce caffeine and alcohol, because obviously that will not give you a good sleep. Adopting meditation and breathing exercises to be able to cope with your moods better. Taking up a new hobby to make you feel better, to occupy your time, to have a breathing space. I think that's quite important. Taking isoflavone extracts like menoflavon, which contains the phytoestrogen, may also help in your symptoms. Tibolone, which is a synthetic steroid hormone. If you're menopausal for 1 year already, that may be an option for you. And of course, the famous Vioza, which has been marketed in Singapore since a year ago. It plays with the thermoregulation center in your brain to make hot flushes better. Then we have HRT, and HRT comes in many different formulations. We have the estrogel, we have the oral form, and I'll come to that much later. Of course, you also have antidepressants, anti-anxiety medications, and sleeping aids if you're unable to sleep at night. And most importantly, support from your family and friends. I think that is always understated. So management for you during menopause should be personalized. Not sure why that's wrongly spelled, but yeah. So do not suffer in silence. Please seek help. So let's talk about HRT. So many different types of HRT, and I'll start from the top. We have the estrogel, which, of course, if you still have a uterus inside in your body, you will need to protect your uterus with oral progestogen or a Mirena, which is a hormonal coil that you put into your womb. Next, we come HRT patches and implants, which is not so popular in Singapore, but that can also be an option for you. Then most popularly in Singapore, we have the oral HRT. We have the cyclical regime and we have the continuous regime, which I'm sure your gynecologists can talk to you more about the brands when you seek help from them. And lastly, ad hoc treatment. If you have a dry vagina, vagina estrogen may also be the treatment for you. So what are the benefits of HRT? Very, very effective in relieving your hot flushes, night sweats, insomnia, mood swings, your mood changes, vagina, skin dryness, makes you feel young again. And so we all know it's a miracle therapy for menopause. And of course, it prevents osteoporosis. And with that, it prevents your risk of fracture as well. And by managing your menopausal symptoms, HRT can improve your quality of life. But what are the risks? Risks are plenty, although I would say the risks are small. So it can increase your risk of blood clots and stroke. It can increase your breast cancer risk if you use it more than 5 years. It can increase your risk of womb cancer if you do not take the appropriate protection. And of course, if you take it more than 10 years after menopause, it can also increase your rate of heart problems. We all know that HRT is popular in increasing your gallbladder disease, including increasing the production of gallstones, and of course, all these side effects that comes with taking hormones itself, like nausea, breast tenderness, headaches, fluid retention, and irregular bleeding. So what are the factors influencing risk? We have age. If you are very close to menopause or you just started menopause, then I think the risk is very low. But if you are already 10 years after menopause or you're close to the age of 60, then starting HRT will confer you a higher risk. The type of HRT, oral has higher risk than estrogel, obviously. And of course, if you use it the shortest duration, lowest risk, longer duration, higher the risk. And we also look at your individual health history. If you have a family history of breast cancer, or if you have formed clots in your legs before, we would say HRT will increase those risks as well. And like I said, oral estrogen will obviously be of a higher risk than going through your skin or patches. So what is my opinion? I think important to consider with your gynae when you see them, that your approach needs to be personalized according to you. Not everybody goes through the menopausal journey similarly. Okay, so it's important to have the decision made with your gynecologist, discussing the pros and cons, whether you need it or you do not need it. And the game plan is to use the lowest dose, safest mode of delivery for the shortest duration so that you get the least side effects and risk from HRT. And bear in mind, if HRT is not suitable for you, we have other types of medication to treat your symptoms. For example, we have antidepressants, we have sleeping aids, and of course, all the lifestyle managements that we can discuss with you to make your life better. In my opinion, if you're experiencing symptoms of menopause that are impacting your quality of life, and if you wonder whether you need HRT or not, the decision is a very individual one. Okay? HRT is very complex and it's not for everyone. So if your neighbor is on HRT, it doesn't mean you need to go on it as well. Okay? So it's important to discuss with your gynae if HRT is right for you. Discuss the risk and benefits of HRT. Discuss about the pros and cons of the different types of HRT available to you. And remember, even if HRT is not suitable for you, there are other types of treatment options that we can discuss with you that may be suitable for you. So this is a picture of my mom. So we went to Bhutan in August last year. And remember I said my mom would have benefited from HRT in her 40s? I never used to be able to travel with her. The moment we talk, we argue, okay? Just very different people, different opinions. And look, we went on a mother-daughter trip to Bhutan. And look, she could climb 7 kilometers with an elevation of more than 1,500. Tiger's Nest is, I think, at an elevation of 3,200 above sea level. And my mother could do a 6-hour hike full of energy. Now her temper is much better, and we are best of friends. So all I'm trying to say is, menopause is not an illness. Menopause is just a transition, okay? Things will get better. In Asia, we call it 2 to 5 years. In the Western world, they say menopausal symptoms settle over 7 to 8 years. Makes me think Asian women are more resilient. But anyway, symptoms can vary widely in type, severity, and duration. Your mental health can be significantly affected, and therefore support from friends and family is very important. So we all know by now there are many effective treatments and management strategies available, and it should all be individualized to you, to what you are going through. So open communication and seeking the right gynae whom you trust is crucial. So this is my last slide. I just want to tell you that ONG is not all just about menopause, right? So if you start as a younger lady, 10 to 19 years old, you might have like menstrual problems, vaginal discharge, pregnancy, if you have early pregnancy, puberty-related conditions. In your 20s to 30s, contraception becomes very important. STDs, pregnant, most people get pregnant then, PCOS, endometriosis, fibroids. The next century and menstrual changes. This is when perimenopausal symptoms will start. Pelvic organ prolapse because of childbirth, gynae cancers, and of course, after 60, all of us want to rule out cancer. Urinary incontinence becomes a problem, and menopause. So it is so important to increase awareness and educate women with regards to all these conditions. So regular checkups, important. Early screening for cancer, important. So that we can detect early and render you the appropriate treatment. Thank you, everyone.
Thank you, Dr. Wee. What an amazing session with you. Now we truly understand women's health more now. Once again, there was Dr. Wee Sturkley. And of course, please do submit any questions you may have for Dr. Wee in the chat, and we'll get to them during the Q&A session later on. Now, ladies and gentlemen, next up, we have for you Dr. Ivan Chua, orthopedic surgeon, Mount Elizabeth Novena Hospital. Now, Dr. Ivan Chua graduated from the NUS and completed his specialist orthopedic training in Singapore before undertaking advanced fellowship training in orthopedic trauma surgery in Germany and the University of Calgary in Canada under MOH's Health Manpower Development Plan. He was formerly the head of the orthopedic trauma service at Tan Tock Seng Hospital, where he led initiatives to advance fracture and orthogeriatric care. Now, beyond that, Dr. Chua is also serving as chairman of the Singapore Orthopedic Trauma Society and the Fragility Fracture Network Singapore, whilst contributing to the advancement of orthopedic trauma care both locally and internationally. An amazing doctor. So, ladies and gentlemen, and now we hand over the remaining time to Dr. Chua.
Thank you, James, for the very kind introduction. I am a practicing trauma surgeon. My other interests will be doing arthritis, robotic joint replacements, bone health, osteoporosis. So today I'm going to talk to you about bone health, osteoporosis. It is a silent risk. We working class, we go to work when the sun is not up, and we go home when the sun is not visible anymore. So this is a real problem for us. We often think about cardiovascular health, but we don't think so much about bone health or muscle health. All right, I have a few infographic slides. I'll tell you the most impactful statistics. 1 in 13 men will have osteoporosis in your lifetime. And for women, 1 in 5. 1 in 5, huh? And 1 in 3 women will get a fragility fracture, an osteoporotic fracture. And 1 in 5 men will also similarly suffer an osteoporotic fracture. Hip fractures are the most well-known of all osteoporotic fractures, and the incidence just doubles every 50 years. What's so important about hip fractures? 75% of hip fractures occur in women, and that means 25% in men. They cause significant disability, chronic pain, and immobility. And the risk is actually comparable to the risk of stroke. What happens after a hip fracture? Many of them can't walk independently. 1 year, 40%. Some statistics say it's 50%. And hip fractures cause the most morbidity. Imagine, after a patient suffers a hip fracture, up to 20 to 25% will not be around with you after the first year. How about vertebral fractures? Only 1/3 of all vertebral fractures are clinically important, meaning we only detect 1/3 of them because they cause pain. That means the 2/3 of them are silent, and they have the same age-adjusted mortality compared to hip fractures actually. How about men? Men have greater risk of fragility fracture than prostate cancer, being prostate cancer one of the top killers for us, men. And the mortality in men is actually higher than that in women. It's something that is surprising. The increase, there is a 300% increase of hip fractures in the next 20 years. The incidence of osteoporosis in Singapore is actually estimated about 400 in 100,000 people. That puts us in the aging part of the world as a developed country. Look at the charts. At the top is Denmark, Sweden. They have the oldest population, and Singapore is not very far away. These two graphs just shows you that we get vertebral fractures first, as shown in the light blue line. In the early ages, we get vertebral fractures first, and in the later ages, we get wrist and hip fractures. They affect later on. So if you do have a silent vertebral fracture or even a wrist fracture later on in the 50s, if we don't diagnose and treat osteoporosis, it may become a hip fracture later on. This is the osteoporosis self-assessment tool for Asians, and it's only validated in women, not for men. So you can see on the box, this chart, you can plot your height, your weight, as well as your age, and then you can roughly tell, are you in the high risk group, medium risk group, or low risk group. And on the right side, there is a chart of all the known risk factors. For example, family history, a previous fragility fracture, aging, low body weight. Many of us don't like to be obese. Height loss, more than 2 centimeters within 3 years. Early menopause, 45 years and younger. Low calcium intake, excessive alcohol, smoking, immobility, for example, sitting in a chair for too long. History of falls and certain medications and diseases that affect the bone itself. When should I get a bone density scan? The OSTA, the osteoporosis self-assessment tool, once you're in a high-risk group, you should consider getting a bone mineral density scan. If you're at a medium risk with one of the risk factors in the chart, you should consider getting a bone density scan. If you're neither of them and you're just going by age, according to current recommendations, if you are a woman above the age of 65, man above the age of 70 with no risk factors can consider getting a bone mineral density scan. And those with risk factors and younger, please do see someone, a GP, someone to get a bone density scan. So what is a bone mineral density scan? Basically, you are shuttled into this room and then you lie down on the couch, your hips are flexed just to obtain a reliable position for the hip. And the machine will take an X-ray over the next 1 to 2 minutes of the hip as well as the lumbar spine. And we end up with those two charts. And we get a T-score or Z-score which the doctor will interpret for you. We interpret the T-score if you're above the age of 60 and the Z-score if we are much younger. So what is the difference actually? The T-score basically compares your bone density to that of a healthy 30-year-old. And the Z-score compares your bone density to an age, race, sex match database of the bone density. So the Z-score is low, your bone density is poorer than others of your same age and sex. So the other thing we use about data from the bone mineral density scan is that we input into this complex table called a fracture risk assessment tool. This tool has been in use for more than a decade and is so useful for practitioners like us who would estimate the fracture risk for you. So we input the age, your date of birth, sex, height, weight, and certain risk factors in there, and then the femoral neck bone density in there. And then we come out with a set of figures and estimation. This assessment tool utilizes a population-based database to come up with this figure. So we have Singapore in the Chinese, Malay, Indians, and Caucasian database. And every population gives a slightly different fracture risk. So if let's say we come out with this risk estimation, 30% major osteoporotic fractures. And what does it actually mean? It basically means in 10 years, 1 out of 3 falls that you might experience, you might get a major osteoporotic fractures. I pause here for a couple of seconds. You can scan this. This is on the International Osteoporosis Foundation website. You go through a checklist and they can actually email to you your risk factors and your osteoporosis risk. So when should I see someone for bone health assessment? So if you have a fracture, you have previous fractures before, you are of the right age group, more than 65 in females, more than 75 in males, go see a GP or in the private clinics or polyclinics. They can further assess and let you know whether you need to do a bone mineral density scan. Or if you have 1 fracture or 2 and you are truly concerned, you can see a specialist like myself. What is a fragility fracture? A fracture that results from minimal injury is a fragility fracture. For example, you trip and you fall down, or you step into you have ankles, you sprain your ankle and you fall down. Yeah, so that causes a fracture. So examples of fractures are like this: proximal humerus, the shoulder, the elbow, the wrist, the hips, both two common types of hip fractures, the knee, ankle, spine. This is a typical vertebral compression fracture. Pelvis. So let's talk about preventive strategies. If you're one of these, you are at risk. Alcohol, smoking, low bone mass index. Right? 4 things that you need to think of for your bone health. Vitamin D, take calcium-rich food, protein-rich food, and lead an active lifestyle. Eat well, take more calcium, take more protein, and take more vitamin D. You can look at this table. There's too many things up there. How much calcium do we actually need? Actually, for us, most are working class, we need about 800 to 1,000 milligrams of calcium every day. Once you are above the age of 60, 70, you need 1,200 to 1,400 milligrams of calcium every day. Because different guidelines may have a slight variability, but it's about the same. And if you truly analyze how much of your diet contains calcium, you will find that your diet do not contain sufficient calcium. How about vitamin D? Vitamin D is important for muscle and bone. Vitamin D helps in calcium absorption from the intestine, helps the bone to uptake calcium. It also helps the muscle to function properly. And amongst that, it also helps your skin and your hair to be more healthy. If you consult a dermatologist, they will tell you, take more vitamin D. How much vitamin D do we actually need? In our working class, we need about 600 to 800 milligrams international units of vitamin D every day. I can tell you this is grossly not enough. How much sunlight do you think you need every day to have sufficient vitamin D on a daily basis? 30 minutes of good UVB. 30 minutes. We don't even get 5 minutes of sunlight every day. If you take this cumulatively, we work Monday to Saturday, or sometimes Monday to Friday, you will be vitamin D deficient. In fact, in our part of the world, in the sunny part of like sunny Singapore, the incidence of vitamin D deficiency is as high as 70%. This has been well published. So think of vitamin D more than calcium actually. How about protein? We all are very crazy about protein nowadays. For example, in healthy adults, we need 30 grams of protein every day. Think about your diet. Do you actually take 30 grams of protein every day? I doubt so. One egg, a 50-gram egg, how much protein? 6 grams of protein. In order to get your 30 grams of protein every day, you need to eat 5 eggs. That's kind of unrealistic. 5 eggs every day. Lifestyle, active lifestyle. I can never stress this more. The only way to stimulate bone is to work the bone and the muscles around the bone. Move. Even in your office, move. Don't keep sitting down. Of course, work ties you up for 1 or 2 hours, but please take breaks. Do something. Do something, for example, walk around the office, move up and down the steps or something like that. Just take the stairs instead of the lift. When you head out for lunch, walk outside. Go outside purposely to get some sunlight. Of course, women are a bit afraid of getting sunlight because of all the skin problems, but it is essential. Every little bit counts in the working day. Let's say we go back. So we often need to think about how to maintain our muscle health and bone health. Think about exercises. What kind of exercises do we actually need? For cardiovascular health, we need aerobic exercises. We run, brisk walk, cycle, just to get the heart to pump harder for a sustained period of time. We also need weight-bearing exercises. So weights are good, excessive weights are not. The third thing is resistance exercises like swimming, and some of the aerobic exercises also incorporate some resistance inside, for example, Pilates. So these three types of exercises are very important for maintaining bone and muscle health. What are our treatment options? Basically, once you have diagnosed to be osteoporotic by your GP or by your specialist, we will talk to you about treatment options and why do we need to treat. Let's look at this set of figures again. 30% risk of major osteoporotic fracture and 15% risk of hip fracture. For us, in our local population, we accept hip fracture risk to be 3% and below. That is very low, 3% of hip fracture in 10 years. So our target of treatment is to lower this risk to an acceptable level for your age group. Broadly speaking, osteoporosis treatment options, they can be divided into oral and injectables. Most of the drugs in the market now, they stop bone from disappearing. Our bone is constantly in a flux, being cleared and being laid. This is the bone turnover cycle. Most of the drugs stop bone from clearing away. There is one or two drugs that build bone, specially stimulate bone, and these are very efficacious in increasing the bone density. So first up, we have bisphosphonates. We have oral form, which is taken once weekly, Fosamax and Actonel, and the injectable once every year. Oral bisphosphonates are usually taken for 3 years if it's injectable, or the oral for 5 years, but they have a limited efficacy. Side effects, lots of stomach side effects, reflux, etc. This is very popular, denosumab, or we term it as Prolia. The generic is in the market already, very convenient to administer, two times a year. Basically, it stops bone from disappearing, and it has a very good net effect of building bone, year on year, 10, 15 years. Side effects, very rare actually. Less than 1% risk, you have muscle ache and joint pain. Rash is extremely uncommon. And once you have gastric side effects, this is the next drug most of the doctors in Singapore would recommend, denosumab. Next up, teriparatide. Not so preferred because this is a daily injection, just much like insulin. And once you start that treatment, it goes on for 18 to 24 months. Very good drug, builds bone very fast and maintains it. There are some side effects, giddiness, high blood calcium, rash. Last up, romosozumab or Evenity. This is what we like as a wonder drug. It builds bone so fast that it's equivalent to 5 to 7 years of taking Prolia, which is the once every 6-month drug. It basically builds bone and also stops bone from disappearing. And the side effects are very, very, very rare, but this is the most expensive drug in the market. So of all these drugs I've mentioned, only bisphosphonates and Prolia are currently subsidized by the government. The rest are not. The risk of osteoporosis treatment, I will just go through very, very briefly. Atypical femoral fracture, which is another type of thigh bone fracture. Usually it often thought of as a stress fracture. No minimal injury, the bone just breaks. Sounds scary, right? But the risk is actually very low. Meaning, why? We are trying to prevent you from having osteoporotic fracture, which is much, much higher risk. And this risk in Asians is actually very low, 1 in 2,000. Osteonecrosis of the jaw, where the jawbone just disappears and melts away. Well, usually this, because poor dental hygiene, there is ongoing bone decay, that may trigger a vicious cycle of causing the bone to melt away. The risk is even lower, 1 in 5,000 to 1 in 10,000 actually. Muscle ache, joint pain, low blood calcium, these are actually quite rare. Your doctor should monitor for these very closely and at appropriate intervals once you're on treatment actually. So last, think about your bone health, muscle health. If you're at risk, you must see someone, see a GP, see a specialist for bone health assessment. And you must stay active. Thank you.
Thank you very much, Dr. Ivan Chua. Ladies and gentlemen, thank you, sir. We've learned so much from you. We've gained valuable insights on osteoporosis. Again, if you do have any questions, please do submit them in the chat and we'll get to them during the Q&A session later on. Now, finally, we have for you our spine orthopedic surgeon from Glen Eagles Hospital, Dr. Huang Yilun. Dr. Huang graduated from NUS and completed his specialist orthopedic training in Singapore before undertaking advanced fellowship training in endoscopic spine surgery at Himnera Hospital in Busan, South Korea. He was formerly the consultant orthopedic spine surgeon and spine service lead at Sengkang General Hospital, where he established the hospital's award-winning spinal triage and rehabilitation star service and pioneered its endoscopic spine surgery program. So now, ladies and gentlemen, he's also part of the faculty for the Endoscopic Spine Academy, contributing to the advancement of endoscopic spine surgery education. Ladies and gentlemen, this is our final doctor today. Let's welcome Dr. Huang.
Thank you very much, James, for the very flattering introduction. Today I'm going to talk about back and neck pain from desk work. So it's really catering to all the working adults out there and how to fix it before it becomes a chronic issue. So I believe a lot of us have experienced back and neck pain at least once in our lifetime. And statistically speaking, at least 1 in 2 of us will have neck and back pain. And at any one point in time, there will be about 1 in 10 of us that will also be experiencing neurological symptoms such as numbness and tingling. And most of the time, I get asked by my patients, when are these symptoms worrying and when do they need to seek medical help? So I hope by sharing today what I have here with you guys, I hope to really shed some light on the questions. And then later on, we'll be going through some of the Q&As, questions that you guys have submitted as well. And that will actually really conclude whatever doubts and queries we have about this topic. So without further ado, let me jump straight to my slides. So this is a bit about myself, very long, but actually at the end of it, what I want to share with you here is being a spine orthopedic surgeon, I also does a bit of trauma training as well as endoscopic training internationally. And the topic for today, which I just touched on, what we'll be covering today, I have really divided into 6 sections. And basically, I will start off with explaining why desk work causes pain. And then we go a bit into the common myths and debunk. And I'll talk about what can we do to actually sort out the issues and the 3 pain hotspots. And then how ergonomic actually fixes what ergonomic fixes that actually works for the working adult, especially in the office. And then lastly, I'll touch on when to actually seek professional help. So before we start, you guys must be wondering whether this webinar is for you. I mean, this talk is for you. So if you are a remote or hybrid employees, you have long hours of desk work, you have been experiencing recurrent tightness of the neck, shoulder, or lower back, or you're just a team lead that's trying to build a healthier workplace culture, so that your team doesn't experience such symptoms, then this talk is probably something that's beneficial for you. Now, why this topic matters? Why is office work and neck and back pain an issue? Because 60 to 80% of the time, statistically proven that we have seen in papers that says that office workers actually report recurring back and neck pain. And a lot of time, these are actually very disabling conditions. They will give you symptoms that will prevent you from being your best, and you will inevitably need to take time off work. And that lowers the productivity of the whole team. A lot of working adults, especially in Singapore, when it is a very competitive society, you spend about 8 to 10 hours of daily sitting time for many desk-based roles. So really, is it a healthy lifestyle for you? Is it really productive for the company? This is something that we've got to think about. And then whenever you look at your computer, your laptop, or even your handphone, and you're actually having a forward tilt of your neck, it gives you about 3 to 5 times strain on the neck. Similarly, when you sit down, there's a multiplier effect on the stress of the lumbar spine as well, and that will give you neck pain and back pain. Now, we do a quick self-check over here, and I'm going to ask the audience, does any of this sound familiar to you? Number one, do you have neck tension that builds up by mid-afternoon, even before the day ends? Number two, when you go to the toilet and you look into the mirror, do you have a rounded shoulders when you see your reflection? You think you look better than that, but actually, when you're tired, the posture is all wrong. Do you have a lower back ache after sitting for more than an hour? And do you have headaches that starts at the base of your skull, especially at the end of the day? And last but not least, the occasional tingling and numbness in your hands or your legs that makes you a bit worried, and then you will start to come and see me. So why does actually desk work hurt your spine? At the end of the day, the desk work doesn't really hurt your spine directly, but it is more of the habits and the posture that you adopt during the day work. When you have a forward head posture and you're leaning towards the screen, you shift the weight of your head and whole body, and you shift the center of gravity from the spine. And that creates a lot of load for the muscles as well as the spine in terms of its structural stress. You have a long static sitting position, and you stay in one position for too long, it reduces blood flows and stiffens the muscles and joints. You have a slouched, unsupported spine, especially when you sit with a chair without a lumbar support, and that causes a lot of strain on the discs and the ligaments, especially when you do not have strong muscles. And finally, a mismatch of a desk setup. Monitors are too low, the keyboards are too high, screens are too small, you need a screen, you tilt your head forward and have a look. Your handphone screen is too small, you're playing too much games on a handphone. All these are just reasons that adds up. And small misalignment adds up over an 8-hour day, and that gives you the eventual problems of pain. How it escalates? Usually it starts off with mild pain and aches, and then you can tolerate it for months and years, and it becomes a habit, day-to-day habit, and you start treating it as a normal symptoms without any thought and without any second thought put into it. And then you develop muscle stiffness after that, and it becomes tension. And that's because your body is trying to protect itself from further damage. And when you have decompensated and your body no longer can protect, that's when you have nerve irritation, where you have these bulges, you have ligaments thickening, and then you have bad posture that causes nerve irritation due to the compression of the nerves in the spine. And when you don't seek treatment, really unfortunately, when you don't seek treatment for such condition, pain actually can generate itself and become a self-recurring issue, and pain itself becomes the pathology. So what we are really trying to do right now, or what I'm trying to advise all of you right now, is really to prevent a simple condition from escalating into a chronic issue because the chronicity of the symptoms actually makes it a lot harder to treat. Now, why this matters, I think I've touched a bit on it already. So we have three segments on this. Firstly, your neck. With a forward tilt, especially when you look at laptops, your handphones, it causes what we call a text neck. Yeah, when you're texting, it's called a text neck. Yeah, I just learned this as well from one of my patients. So when you have a text neck, that's when you have a lot of slouching, a lot of neck pain, and you know our body is all connected. So when you have a text neck, it goes to become it can bring on a rounded shoulders when you start slouching in front. And rounded shoulders actually is also because you have a forward tilted posture, where you start reaching for your keyboard, your mouse, and unknowingly you guys will actually adopt this posture for the whole day. And then finally, because the lumbar spine is also not supported, you have low back pain. We go on to whether a few of the myths and the facts that I'm going to share with you here. They always say, patients always ask me what is a good posture to adopt. I always tell them the best posture is your next posture. So you need to keep moving. Even if you adopt a most neutrally aligned posture, if you hold it for more than an hour, 2 hours, or a whole day, 8 hours, you tend to have pain. And that's because your body is not used to being in a stationary position. And therefore, your best posture is your next posture. You got to keep moving. Mobility is key. Motion is lotion. So you got to keep your joints supple, and your muscles will be also, your joints and muscles supple, and therefore your symptoms will not happen. And you'll feel more comfortable doing your daily chores. A better chair alone will fix your pain. Obviously, that's not right because there are a lot of other stuff that matters, even your own body height and daily habits. Pain means you should stop moving entirely. Not entirely true. Sometimes if you experience a bit of aches and pains, it's because you haven't been moving, and therefore you need to move more. A gentle motion, gentle movement and stretching usually speeds recovery from muscular pain, which is the benign kind of pain that you may have. So how do we set up a workstation correctly? Usually, I will advise my patients, 4 big points. Monitor is at your eye level, so you do not need to forward tilt your head. You do not need to actually have a downward or upward gaze. And you can keep your cervical spine in a neutral position. Your feet is flat on the floor. So if your feet you're tiptoeing or you're actually squatting on your chair because you're too tall, those are bad for your lumbar spine. Elbows at 90 degrees. A lot of us probably don't adhere to this because you don't get to decide your workplace desk and tables and your chair height as well. And all of us are of different height. So workplace that have standing desks and standing working station is actually the better ones, where it allows you to sit and stand and keep having a change of posture regularly throughout the whole day. But unfortunately, not all offices have that, so only you can know what to do for yourself. And finally, lumbar support engaged. You can put a cushion, or you can find a chair that has actually a lumbar support that curves inward and support the lower back when you're sitting down. Some things that are worth the investment. Again, four things that you can decide whether you want to put some cash into this. They are not cheap, but they can help you in the long run. Ergonomic chair, adjustable height, seat is actually quite supportive. It doesn't sink down, and you have a good lumbar support where there's a lumbar curve at the back to prop up your lumbar spine. You have a monitor arm and stand that really gets the screen to be true to your eye level. And most importantly also, a lot of people was telling me like the keyboards and the mouse, they are very curious, why does it matter? It matters because most of our keyboards and the mouse, if you belong to my era, they are all wired. So if you're wired and the wire is short, then you tend to reach out and you want to actually have a forward posturing. And nowadays with wireless keyboards, wireless mouse, you have more freedom to actually decide how you want to sit and how you want to actually properly align yourself to the workstation, and that is naturally better for you. I put this slide up here because, like I said just now, any good posture that you adopt and you don't move, it becomes a bad posture. So really, you need to take regular movement breaks in between, and do simple stretches, especially after a 30 to 60 minute sitting posture. I would advise my patient to actually get out about 40-45 minutes and do a 15-minute stretch. You can take a walk, take a toilet break, stretch your neck, your shoulders, and then you can change your position and really just have a breather, and that will make you walk the longer distance eventually. So remember to take breaks, set a recurring timer if you need to. Don't rely on your willpower because none of us have that. And eventually, I think over many years, you'll realize the benefits that it'll bring you. If you really cannot stand up in the office, then these are the micro stretches that you can do. So I understand some of you may have, a workplace condition that doesn't allow you to stand up. You're too shy to stand. Then try and do this whenever you can. You do a side stretch of your neck, your ear towards your shoulder like that and like that. And you hold it for 15 to 20 seconds each time. And then you have a seated spinal twist where you gently rotate your body. I'm feeling a bit of ache now. Yeah, and that helps also. And you hold it for about 10 seconds. And you can do it as regularly as you want to. And the wrist and forearm stretch also helps, especially when you're typing furiously for about a few hours. And then the ankle circles will keep the blood flowing in your calves so that you don't develop, blood clots and, leg swelling at the end of the day. These are simple things to do that you can do it microscopically, and none of your colleagues will judge you for it because they don't even know about it. So if you cannot stand up, these are the micro stretches you can do. And then strengthen and mobilize daily. Again, 4 exercises. I decided on 4 because I think that's the easiest to remember. Of course, there are more. You can actually Google them online. Now, core strengthening will be the mainstay of treatment, or rather mainstay of action for you to actually prevent further episodes of back pain and neck pain. You have shoulder blade squeezes, simple chin tuck exercises, and chest openers when you put your arms behind you and then you just stretch your chest out. A lot of people don't know this, but the chest and your upper back muscles are actually connected to your neck. So if you have a chest tightness and upper back tightness, it will eventually give you neck issues as well as headaches. So you can try it right now if you are at the desk watching the webinar. Stand up, you can push back from the desk and stand tall. You do 5 slow rolls of your neck in each direction. You can do a lateral rotation, you can do a lateral flexion, rotation, and you see whether you feel the ache slowly leaving your neck. Do shoulder squeezes. So you pull your shoulder back blades up, you hold for 5 seconds, and if you cannot see it, I shall turn my body and let you see. So this is how you do it. And you hold for 5 seconds, because anything less than 5 seconds doesn't really work. And do it as many times as you want to, because that actually loosens up your shoulder muscles. And do chest openers where you clasp your hand behind your back, lift it slowly, and you need to really stretch out your pectoralis muscles. With a good thoracic extension, then your neck can be in a neutral position. When your thoracic spine is actually slouched forward and flexed, your neck cannot be in good position. And no matter what kind of stretches you do to your cervical spine, the pain will still be there. And finally, do a 2-minute of easy walking. I always tell my patients to take toilet breaks and say that they need to go to the washroom because nobody can prevent you to go to the washroom, even your boss. So then you have the excuse of walking throughout the whole day. Now, this is going to be one of my last few slides, I think. Know the limits of self-care. Most of the time, back pain and neck pain are actually very benign condition. You get to treat it yourself. You don't really need to see me. But when do you really need to see me is when you have these symptoms happening to you. 4 symptoms again. Pain radiating down your legs, your arms, pain that wakes you at night and doesn't go away. You have any numbness and weakness of your all 4 limbs, actually, your hands and your legs. And by adhering to a physical therapy program and you don't see any improvement in a few weeks' time, even though you change your lifestyle, you change your activities, then maybe it is time for an evaluation. So with that, I do a recap with you guys. Now I increase a bit. I put it as a 5 points now, because I think you guys can remember 5 points at the end of the day. Pain builds up gradually, so small habits actually will prevent the big problems, and you got to start now. The neck, upper back, and lower back are your 3 hot spots. So take care of them, and they will take care of you in the future. Set up your monitor, your chair, your keyboard to match your body so that you do not feel, your body does not need to undergo this unnecessary stress every day when you work. Move every 30 to 60 minutes, even for a brief 2 minutes. That it will help you enough. And if you have persistent or radiating pain, that is when you need to come and see me. Thank you very much.
Well, thank you very much, Dr. Huang Yi-Lun, for the super informative presentation. Your talk has got everyone moving in the studio. Everyone has been sitting down for a long time now. Thank you very much, Dr. Huang. And of course, for those of you who are here online, again, please do submit your questions. We're about to reach the Q&A segment. In just a while, we'll be addressing all your questions. So please keep the questions coming. As you can see, I'm moving more than usual now. It helps. All right, so please do that. And at the same time, we'd like to tell you more about this app that's going to change your life. That's called a My Health 360. It's super useful. It's your trusted healthcare companion for health, for life. Now, taking charge of your health is very easy with the new app. You can use it to connect with a Parkway Shangton doctor through teleconsult. You can use it to book e-appointments, retrieve your EMCs, find specialists, treatments. You can get access to your symptom checker, book your TCM consultation, and much more. I'll take a look at the features that we have for you on screen. Now, for those of you who are interested in having the app, which I think everyone should get one, all you have to do is scan the QR code. There you go. Download My Health 360, your healthcare companion for health, for life. And of course, again, the questions are about to be flashed to us. We'll be addressing it to all our lovely doctors here. So we thank you very, very much for joining us. So ladies and gentlemen, again, welcome back. And we'd like to say hello to all our doctors here. Big round of applause. Yay! Thank you very much for joining us. Now, we'll be having the questions to be addressed to each of the doctors as we deem fit. So we'll be going through one by one. Now, first question goes to Dr. Wee. Now, Dr. Wee, weight control, especially belly fat, what do you do to control them? And how do you prevent muscle loss through perimenopause and menopause?
Right.
It's a loaded question.
This is a very common question in my clinic. So personally, I feel it too. So once you hit 40, I think it's really hard to keep the weight down. I think your metabolic rate kind of reduces. So cutting down on your carbohydrates, I think it's important. I know you need to have a balanced, healthy diet, but carbohydrates are a culprit. At the end of the day, it's calorie intake and output, isn't it? And you need a calorie deficit, you want to lose weight. So I think cutting down on the carbohydrate, make it nutritious by having more protein, have lots of vegetables and fruits, and exercising, right? You want to kind of increase that calorie output. So do that 8,000, 10,000 steps a day. If you've got a watch to track, that would be great. You do? Good.
I do.
Good for you.
1,000. 9K more to go.
You got a lot to go. And I think in the exercise, it's not just running or cardio. I think it's also really important for ladies going to menopause to build muscle strength. Strength training is so important. So hit the gym, get a good personal trainer to actually teach you all the good exercises to build upper body strength, leg strength, and so they can do it safe and effectively. And having muscle around your bone is also good to protect you against falls, right? As you know, osteoporosis becomes a risk as you reach menopause, and having that muscle to protect your bone actually reduces your fracture risk. Yeah, and also once you're menopausal, make sure you take your calcium and vitamin D, as what Ivan was saying, so that you can reduce that bone density loss. What else? I think for strength training is also important if you want your muscle to recover quickly. Magnesium I super love magnesium as a longevity drug. I think creatine is also really good. Yeah, and I think the belly fat, even I still have it. It's a childbirth thing, right? And as you grow older, yeah, you cannot see. As you grow older, it's just very hard to get rid of. So what I'm trying to say is we need to set ourselves goals, but we also need to be pragmatic about it. We need to manage our expectation, have that goal stepwise ahead so that you can look forward to it. And every step you reach is a win. Yeah.
That's a great answer. Thank you very much, Dr. Wing.
Yeah.
Great answer. All right, now the next question goes to Dr. Chua. So the denosumab injection, the zoledronic acid infusion are treatments for osteoporosis. Please share the risks and the benefits of these treatments.
I have shared the risk inside my talk. They are actually different drugs. Zoledronic acid is a bisphosphonate. Primary action is to stop bone from clearing away. It's an anti-resorptive. Denosumab is also an anti-resorptive, but it has also weak anabolic, meaning build bone properties. I would say the efficacy of denosumab over time is far greater than that of zoledronic acid. Why? Because zoledronic acid if we do start, we give it for 3 years, and we usually expect lumbar spine bone density gain by about 7 to 9% max. Whereas in denosumab, we can give it, current data is at 15 to 18 years and very safe. The density just keeps going up. So if we all think if we do start the bone density T-score from a very, very negative means no good. The more negative, we have to use a drug which lasts, we can give for longer periods of time, can raise out the bone density a bit faster, so that in the end, the net result is to decrease your risk of having a fracture. So the risks are actually fairly similar.
Thank you, Dr. Chua. All right, next question goes to Dr. Huang. Now, sir, how to correct and reduce or eliminate neck and back pain from years and years of desk work and suboptimal posture? Can you reverse that? Can you reverse all the damage that has been done?
Well, I think at the end of the day, I mean, you got to start now, right? If you have been doing this for years, you know there's bad postures, then I think first thing first is try and see whether ergonomically you can change anything. Change your work desk if you need to. Your workstations need to be perfectly suited to your individual needs. So really the monitor needs to be at your eye level. You have your elbows at 90 degrees when you're actually working, your feet on the ground. And this thing needs to be adjusted to your own personal height. So everybody is a bit different. And sometimes due to workplace limitation, of course, it's a bit hard to achieve that. So you need to move. And I would generally advise that every 45 minutes, you get up and start moving around. I shared just now that motion is lotion, mobility is key. So I'm going to say that again. So basically just keep moving. And I think your muscles, your body, your joints, and your ligaments, your body needs that, the motions to keep the blood circulating and the oxygenation to reach them. And this will give you good, healthy tissues. And therefore, it will eliminate pain. And of course, besides moving, of course, you can also do few simple things like stretches. So it's a double S. You stretch yourself, you stretch your contracted muscles at the end of the day or after a prolonged seated position. You also need to strengthen after that. So stretches and strengthening helps over the long run. And when I say strengthening, it actually really means strengthening your core muscles, as well as your spinal muscles, so that these muscles can actually take the load of the spinal structures itself and it prevents damage to the inherent nerve elements that you want to protect. So yeah.
Thank you, Dr. Huang. Now, motion is lotion. I love that. Now, sir, can I ask you, just for fun, take a look at all the people sitting down. Who has the best posture? Dr. Ivan has been moving for the past 5 minutes.
Yep.
He hasn't moved. He should move.
I
Right?
guess for 5 minutes, I would say Ivan has the best posture.
But he hasn't moved at all.
Well, we give him a limit of 45 minutes, right? So he actually has a very good posture.
Yeah, he has. Okay, now the next question. All right, Dr. Wee, at different age stages of women, now can you list out the type of health screenings, diet, and exercises we have to take at different stages?
Well, that's a very big question. So I'll just start with health screening. So pap smear for cervical screening, that starts at 25, 26, and it goes on to 69. And then we also have mammogram, which is to screen for breast cancer. That starts at 40. But if you have a family history of breast cancer, you start 10 years earlier than the diagnosis. Younger ladies before 40, usually we do ultrasound breast to screen for cancer because of the density of the breast. Above 40 will be mammogram. And 40 to 50 will be yearly, and after 50 will be every 2 years once. But if you're on HRT, that will be every year. Now, what other health screenings we have? We've got all the blood tests, ovarian cancer profile, which includes the CA125, and that screens for ovarian cancer, although 50% of stage 1 ovarian cancer has a normal CA125, which is an ovarian tumor marker. What are the health screenings we have? BMD to screen for osteoporosis. Those are the ones that are common in terms of screenings. And of course, all the blood tests, right? To screen for diabetes, screen for high cholesterol, that we have commonly in our health screening packages. Diet-wise, I think a balanced, healthy diet for sure. When you are pregnant, you are not eating for 2, you're eating for 1 nutritiously. You do not need extra calories in the first trimester. In the second trimester, you need an additional 150 to 200 calories per day. That's not much, is it? And then in your last trimester, you need about 250 to 500 calories per day extra, depending on your size. So that's diet. And of course, when you're menopausal, remember your calcium and vitamin D, important for your bones. Anybody menopausal, I always advocate multivitamins. Yeah,
That's
I think
great
it's good.
advice. That's great advice. And,
Yeah.
and by the way, you were saying if you're a pregnant woman, you eat for 1, not for 2.
Exactly.
Is that
So I
is that
always
true?
say-
Hang on. If my wife is watching this, you need to hear this.
So you can
Eat
tell
for
your wife
1,
this.
huh?
You can tell your wife this. You're not eating 2 bowls of ramen when you go to Tokyo. You are eating a bowl of ramen, but you add the char siu, you add the egg, you add the nutritious stuff in to make
There
it
you
more
go.
nutritious.
There you go. That's a very
Yeah.
wise answer. Okay, now the next question. Next question goes to Dr. Chua. Dr. Chua, is it beneficial or necessary to take supplements like glucosamine, calcium for bone health, knee pain? How to prevent it? So 2 questions. I know some people, they swear by glucosamine. Now, what are your thoughts?
2 parts. I can answer. I take this into 2 parts. I think in my talk I didn't cover the supplements in detail. For calcium, good for bone, good for supplementation because our diet is not enough calcium. 600 milligrams to 1,000 milligrams of additional calcium a day will be sufficient. Don't be afraid of kidney stones, heart problem. If your kidneys are functional, healthy, you don't form any kidney stones at all. So you need that additional supplementation to fill up what you can't take from your diet. Glucosamine for joints, well, it is I will classify that as a myth. Everybody likes to take it. A lot of doctors like to give it. Why? Because there is a placebo effect, and it is real because this has been proven in studies more than a decade ago that glucosamine has not been shown to have a positive effect on reducing joint pain and preventing arthritis. And it's nothing more than a placebo effect. So on calcium, 600 to 1,000 milligrams of calcium a day. Additionally, for vitamin D, at least 600 to 1,000 IU of vitamin D a day. That should get you through.
Which means, like what you said, 30 minutes of sunlight. as much as possible.
Yes,
Every
30
day.
minutes is actually very hard.
Got it.
Even my vitamin D is low.
Oh.
I am taking vitamin D supplementation.
Mine too. My vitamin D is low too.
And
really?
And it's very consistent. I had a couple of vitamin D checks in the past few months. If a period I stop my vitamin D supplementation, I'm indoors, our profession is indoors. Vitamin D level drop. So don't be surprised, head to your GP, check your vitamin D, it might be low.
I think we're too hardworking.
Yeah, you could meet your patients outdoors, all right? That will help. All right, now the next question. Dr. Huang,
Yes.
now what tests can help early detection of bone degeneration and disc compression leading to pressure on nerves?
Wow, for the friend, our buddy that's asking this question, I'm very sorry. It's almost definite that your bone is undergoing degeneration, so I don't think you need any test for that. All of us are aging, so it's really hard to tell. I mean, there's no need for a test that actually predicts early bone degeneration. But I think what he's trying to ask is whether there's anything that's telling us whether the nerves are actually at compromise. Typically, in our medical world right now, we actually go by symptoms. So really, we look at whether you're having actually any nerve symptoms, any sciatica or radiculopathy from the upper limbs or lower limbs, and then we decide whether clinically we need to actually further investigate. And I think the gold standard for detecting nerve compression in the spine is still an MRI scan. Of course, there are some patients that cannot undergo MRI scans, then we'll consider CT scans. But by and large, MRI scan is still the mainstay, and it's generally safe because there's no radiation involved. The only issue is the cost of it, and of course, get your insurance.
There you go. So MRI, still the gold standard. I see. Okay, so next question, Dr. Wee. I think this is a common issue. How do you address postpartum issues during early 30s for the second child? Recoveries always seems to take a very long time with work stress. What do we do, Dr. Wee?
Well, I think it depends on what the postpartum issue is. If the postpartum issue is postpartum depression, then I think you really need to seek help from a psychiatrist, because we need to talk out the issues, and possibly you may need some medication, an antidepressant to tie you through the period. But if the postpartum issue is because it's tiring and it's difficult to cope, I mean, you are Wonder Woman. All us mothers are Wonder Woman, right? Yeah. And I think it's even worse because you have a second child. That means you have a first child who's a toddler. And so it's difficult to juggle toddler, baby, and at work as well, right? And you're probably breastfeeding. Breastfeeding takes a toll. You're not having enough sleep because of the baby crying. And you have to go back to work tired and pumping your breast. I think it's tough. So you are a Wonder Woman, whoever is asking this question, and even Wonder Woman needs to ask for help. And you need to ask for help to have a personal mean time to take care of yourself. It takes a village to look after 2 kids. And what I'm trying to say is not because you can't cope. We're all Wonder Womans, right? You are asking for help and you're asking for self-care and rest so that you can be a better Wonder Woman.
Also, a perfect answer, really.
Yeah.
And a shout out to all moms. We all are Wonder Women, really. So really, thank you very much for a great job done. Every day should be Mother's Day, all right?
Yeah.
All right. So the next question, Dr. Chua, are there any side effects for osteoporosis patients who receive calcium injections? Now, this is something we hear since many years back. Could their bones become brittle or fragile after taking so many injections?
I'm not sure what background this question came about. We don't give calcium injections. Why? Because the calcium in the blood is actually very, very tightly regulated. If we give additional calcium by the blood, it could raise the blood calcium to a dangerous level that can affect the heart rhythm, muscle function, or even the gut function. So calcium is better taken oral, so it's slow. We have the effects of hormones to buffer the uptake, and so that we don't get too high calcium in the blood. I don't think if in the setting of someone who is receiving calcium injection for low blood calcium, I don't think it has any effect at all, actually.
Thank you, Dr. Chua. Thank you very much. Now, next question, Dr. Huang. Now, the area below the neck at the back center feels achy from time to time. What can I do to release and strengthen? And which area is that? Area below the neck at the back center. Here we go.
I think what he's trying to ask is actually basically neck pain and maybe upper back pain, which is actually very closely related. This area is actually where your rhomboids and your trapezius are. And if you need to stretch it out from time to time, you have aching, releases are actually done in many ways. James over here actually has a massage gun that maybe he can share with us.
Yeah, I do.
These massage guns are actually easily available in the market right now. It's getting very popular. Some of the physical therapy centers actually already have them. And they come in all shapes and sizes with really funny attachable knobs, and it allows you to do it for yourself actually. You have a curve attachment that allows you to just massage your back. These are actually quite useful as a trigger point release where you actually apply pressure. If you don't have that, or if financially you're a bit constrained, you can actually use a roller ball. Any massage ball, you put it on the wall and you just press against the tender spots, and that will also help with the muscle release. With regards to strengthening, what can we do to strengthen? Before I jump to strengthening, another kind of release that you can actually do, you can try dry needling, but of course get a trained physical therapist to do that, or things like acupuncture can actually help to release muscular tension. Go to a proper TCM practitioner. And then we go to strengthening after that. Now, how do we do strengthening? I think one of the most simple exercises to strengthen your upper back and your neck will be what we call the YWT, YTW. So you just basically lie prone on the ground and you basically do like a swimming action. So you go for a Y, a T, and a W with your upper back elevated. So that's actually strengthening.
Shall we have a demonstration, please?
Not in the proper attire.
So Dr. Huang is actually endorsed massage gun. So you see that online from time to time, and the prices are getting cheaper now. So massage gun can help from time to time. Yeah.
Don't overdo it.
Don't overdo it.
If you still have a lot of pain, come and see me first.
Don't take over his job, okay? Yeah, here we go. All right, now the next question. So the next question, Dr. Wee, we're talking about a small frame lady in her mid-50s. Family history of osteoporosis and is herself osteopenic and worsening BMD. Is hormone replacement therapy advisable? Is there any kind of risks?
Well, I think it depends on whether she's got other types of menopausal symptoms, right? I think because HRT itself has many, many risks, as you saw from my slides. Important risks like breast cancer, increased risk of cancer to the womb if it's not protected properly, increased risk of stroke, forming clots in your legs, increased risk of gallbladder problems. So it doesn't come without any risk. If her main problem is being osteopenic, she should go and see Ivan. No, but of course, it's well known. HRT prevents osteoporosis. So I think it's not an easy answer to this. We need to sit down with her and see what she wants and what she needs and decide
like what you
accordingly.
said, everyone is different. We need
Exactly.
a customized plan for every individual.
Yes, that's
I've been
right.
listening to you.
Good.
So there you go. So next question, Dr. Chua. Prevention tips on how to manage osteopenia.
Actually leads to this question. Osteopenia prevention. 4 things. Number 1, stay active. Stay active. Exercises, 3 types of exercises. This is like I explain to my patients: weight-bearing exercise, resistance exercise, and cardiovascular exercise, aerobic exercise. So 3 things, 3 exercises. Number 2, calcium. Adequate calcium intake. Number 3, adequate vitamin D intake. And number 4, protein intake. Adequate protein intake. So you combine all this. These are 4 ways to manage, to improve your bone and muscle health. So if you're osteopenic, don't fret. Your aim is to maintain. Okay, is to maintain, not to start treatment. Your doctor may score you your fracture risk on using Frax. If it's low, if it's high risk, may decide after a thorough discussion to put you on treatment because to treat the fracture risk. But generally, our local doctors will start treatment only if the T-score is negative 2.5 and below. So if you're osteopenia, don't fret. Just do these 4 things.
There you go. Very wise and balanced answer. Thank you very much, sir. Okay, the next question. Next question is, Dr. Huang,
Yes.
someone's interested to know more about improving backache and aching on the sciatic nerve.
Okay, I'm guessing this person asking is having some sciatica and some back pain issues. I think in the acute stages when you're actually experiencing pain and especially when you have sciatica, you can take a day or two, just to have complete bed rest and take some medications. But what we actually advise patients is really to get up and move around as soon as they can. And that has been proven that it will give better results in the long run. When I say getting up and moving around, what do I mean? So basically, I allow them to walk. Walking is the best form of exercises. Maybe not 8,000 to 10,000 steps a day, but maybe we go with easy 2,000 to 3,000 if they can. And then after that, I tell them that they can try and swim if they want to. And all these are actually extension-based exercises. We try and avoid a flexion posture because a flex posture actually worsens, a slip disc, and then it causes more nervy symptoms. When you walk, of course, if they tell me that, oh doc, I can't even walk, I take a few steps, I'm in pain, then it'll be great if you have a swimming pool. If you have a swimming pool, you walk in the pool. The water will actually offset your body weight and gives you some support as well. Static exercises that you can do, usually just nerve flossing at the start. Nerve flossing, what do I mean by that? Really, it's a flossing of the nerve, of your sciatic nerve. You can actually Google that. There are a few ways to do it. Generally, you lie down and then you move slowly. You move your knees, your hips, and then your ankles. And then slowly you couple it with your neck, range of motion, and that will give you symptoms relief over the long run. And finally, you can add in some medications. There are a lot of neuropathic agents that help with nervy pains. And this conservative period that you're doing usually lasts for about 6 weeks, and you see whether there's any improvement. And if there's no improvement, then it's time for further interventions and investigations.
It's a great answer. Thanks, Doc. Thank you very much. Now, I think one thing we can take away after listening to you is to really move more than you can, right? As much as you can. Movement is great for the body.
That's right.
Right? Okay, we'll. It's a great reminder for me as well. Okay, I think we have 4 more minutes to go. Let's see how much we can cover. The next question, Dr. Huang, or rather Dr. Wee. Now, how long will perimenopause symptoms persist? Is there a way to handle perimenopause? I'm not going to say everyone's different.
Everyone's different and thanks, you've been listening to my talk. Okay, so survey has shown that in the Western world, 7 to 8 years average. In Asia, actually shorter. So I think Asian women are either more resilient or people still see to it that it is like a taboo to say that you're suffering and seek help. And yeah. So in Asia, it's reported as about 2 to 5 years, so slightly shorter. How to deal with it? I think I've already spoken in my slides. Balance healthy lifestyle, exercise, take care of yourself, have plenty of rest, reduce on the caffeine, reduce on the alcohol, take up a hobby, being insightful, have the family support, your husband's support, and also that people understand you're going through a transition. And if all that doesn't help, come and see me or a gynecologist whom you trust, so then we can discuss treatment like HRT.
Oh, that's great. Great answer. Great answer. All right, now next question. Dr. Chua, can we cure osteoporosis, and how much are the screening charges for osteoporosis, or ballpark?
Cure osteoporosis actually is reversing the bone density, the poor bone density. I presume that is what you mean by curing. So we have to have treatment. That means they put on medications in order to reverse that. Sometimes one medication over a few years is not enough. We can't sequence the medication so that the bone density can be reversed. Screening charges for osteoporosis, actually one consultation plus one bone mineral density scan. I think nowadays bone mineral density scan is about $250 to $300. It's cheaper if you do in a polyclinic, but in a private setting, it's also equally affordable.
That's very helpful. Thank you, sir. Okay, the next question, Dr. Huang, how do you care for slip discs? Like if I have an issue, how do you care for it?
I think we touched a bit on that just now, which is basically symptoms of sciatica and what to do at home. I'm going to just touch a bit on what not to do then. Basically, when you have a slip disc issue, if it's giving you symptoms, generally, I would say activities, we need to have a bit of alteration. No high impact stuff. Tell them not to go for runs, especially long runs. If you like sports, things to avoid is really things that has a lot of jumping. I guess basketball, badminton, even tennis sometimes can aggravate symptoms. And finally, one of the worst sports that to really engage in at this point in time is really things that cause pivoting of the spine, and that would be like golf, which is why Tiger Woods has 3 times spinal operations before. So these are the activities that I'll try to tell them to avoid. Take the medications and then do the exercises that we spoke about just now, and the symptoms doesn't get better. You notice that you're getting weaker, the symptoms are worsening, or you actually have problems controlling your bowels or your urinary action, then this is a time to actually seek medical professional opinion.
Thank you so much, sir. Thank you. All right, now, ladies and gentlemen, well, we thank everybody for your lovely questions. Now, we're sorry we couldn't get to every one of them due to time. We greatly appreciate you spending your lunchtime with us, and we hope you truly find this webinar useful. We all did. Now, once again, a heartfelt thank you to Dr. Wee, Dr. Chua, and Dr. Huang for taking time to share such valuable insights on staying healthy today while protecting your tomorrow. So, well, before you go, I would love to have your feedback on today's webinar via our survey by scanning this QR code. Now, the first 20 of you to provide feedback is going to walk away with a $10 Grab voucher. All right, so please, share with us what topics you'll be interested in for future webinars so we can keep a lookout for you. Please do scan the QR code. Your feedback is important for us. Right now, once again, we thank you very much for your time. We'll be flashing the details of our speakers in just a bit. This webinar is brought to you by iXchange, your trusted TPA and medical services provider. Please email us if you do have further inquiry after today's seminar. All right, at this moment in time, I would like to thank the doctors again for joining us. Let's give the doctors a big round of applause. Thank you, doctors. Thank you very much. All right, so thank you, everyone. We hope to see you again very soon. Have a great week ahead. Bye-bye.